Good morning. This is Nicole Coursey. We're going to get started in about 4 minutes. If you plan on asking a question of our presenter, I need you to make sure that you use the phone call-in information and dial in with your access code. You can use your chat feature as well. We will get started in 5 minutes. Good morning. This is Dory Chudy. I'm the former primary care officer for the Bureau of Primary Care and Rural Health. And today we're talking about the state primary care office and workforce development program. This is part of a continuing information series by the Department of Health, the Office of Public Health, Bureau of Primary Care and Rural Health. And it's part of a series called Ask Rural Louisiana. And you will see more about this series as other webinars are being put together. And if you have a request for a series, you can send that request to Nicole Coursey or Tracy Ingram. And this is our little disclaimer, so you can read that at your leisure. This presentation will be sent to you after the presentation is concluded. Now, just an overview, the Bureau of Primary Care and Rural Health, this is State Primary Care Office 101, but we did change the title to Rural Recruitment and Retention Services. But this is part of the a series of webinars, and they were developed for organizations and stakeholders who seek to learn about the rural planning and opportunities that are available to the public and other organizations and state government, also local government, through the State Office of Rural Health, Primary Care Office, Recruitment and Retention Program, including community development and working with critical access hospitals and rural health programs. The series provides an opportunity to learn about the Bureau's efforts to increase access to care in health professional shortage areas and medically underserved and rural areas. Today, this presentation is designed to help participants to better understand the role of the primary care office. And we love our acronyms, so throughout this presentation, you'll see lots of acronyms. So if you're not familiar with one and we've forgotten to preface at that, let us know. Where the primary care office fits into the Department of Health, whom we serve, the partners of the PCO, the services of the PCO, and then how to contact your primary care office staff. And this is how we fit in the organization with Department of Health. Dr. D, of course, is at the top. Our units are located under the Office of Public Health with Dr. Jabari as its lead. Then we are located within OPH under the centers, and we have several centers under OPH. This center is for community and preventative health. So then we have the Bureau of Primary Care and Rural Health and several services located under that. What we're talking about today, you'll see in blue on your presentation. The Primary Care Office, State Loan Repayment Program, Workforce Recruitment and Retention, and Health Professional Shortage Areas. You'll hear about those. We refer to them as HPSAs. So it's important to know also where we fit in on a federal level. The Primary Care Office is funded through HRSA, Health Resource Services Administration. Now, HRSA has 5 bureaus that you see listed here in bullet points. We fall under the Bureau of Health Workforce, and that bureau administers the programs and the grants designed to strengthen the workforce and connect skilled professionals to opportunities in rural, urban, and tribal underserved communities. This is nationwide. The other bureaus there, they have services that fall under other areas of the Office of Public Health, but these programs also support their efforts. Then on a state level, we are the strategic partner for the Bureau of Health Workforce, and we being the primary care offices. We undertake the initiatives centered on improving access to health care for medically underserved areas and populations. So, who do we serve? Healthcare professionals, facilities, state and local agencies and organizations that provide services in a HPSA, and that's any type of HPSA. And those facilities accept Medicaid, Medicare, and all patients regardless of their ability to pay. That is our target audience. And these are some of our partners on the state level and on the national level. And I'll let you read those and let me know if you have questions. So the primary care office offers assistance in these areas in HPSA designation, the National Health Service Corps, the Nurse Corps, the State Loan Repayment Program, the J-1 Visa Program within Louisiana, the Conrad State 30 Program, Oral Health Workforce Development Grant, and then the Primary Care Access to and with FQHCs. Our work starts out with HPSAs. So and workforce is dependent on a health professional shortage area and their scores. So we're going to spend some time talking about HPSAs. There are 3 different types. There's a primary care medical HPSA. There is a dental HPSA, and there are mental health HPSAs. Now, HPSAs are identified and tell a story of the shortage of workforce identified within a certain geographic area. Now, many of you have seen these maps. These are the latest maps, and you can go to our website, the Bureau's website, and pull these down, or you can pull them down off of this presentation. This is a primary care HPSA. Now, there's different levels, 2 different levels. You'll see blue and you'll see a yellow or a gold color. The yellow, or the the blue color is a geographic HPSA. That means they met all the criteria for the entire parish to be considered a health professional shortage area. The low income did not meet the geographic designation, but they had enough of the low income population within their parish to also meet that parish-wide designation. You'll also see partial designations in low-income population areas. This is our dental HPSA. Again, the geographic and the low income. So you can see much of our state, even though I know everyone works real hard on recruiting and retaining, we still have pockets of professionals lacking in those areas. And lastly, we have the mental health HPSAs. The purple being geographic, the yellow or gold being low income. There's another designation for HPSA, and that's called an automatic HPSA. There are two groups that qualify for this automatic HPSA, and that's FQHCs, and HRSA assigns that score based on UDS information. The other group is rural health clinics who offer discounted fees to patients that qualify. They can also apply for an automatic HPSA. Now, automatic doesn't mean you automatically receive that score without an application. So don't let that mislead you. You still need to apply and make sure that it's showing up on the website and that you have a HPSA score. So these, I'd like to point out, I'm sorry. Okay. We're going to, I hit the wrong button.
Oh, okay.
We went to the last instead of, we're pausing a moment here. Okay.
There you go.
Okay, here we have Beth Butler and her contact information. She is our HPSA specialist. So if you have questions about a HPSA or an automatic HPSA, you can contact Beth Butler. You can also find the maps and the links on our website. That's the link to that website. You can find also information on populations that are used in HPSA from the Census Fact Finder. And then to find out your HPSA designation and score, there is the HPSA website, and that is hpsafind.hrsa.gov. That website is updated daily. So if there's any changes, you can find it there. You can find a HPSA by parish. You can find a HPSA by address. And it's best that you find it by your address if that's available. Okay. These are programs that we're going to talk about under the National Health Service Corps, and they all require a HPSA. The loan repayment program, I've put some dates behind these bullet points, and these are the dates that you can expect the bulletins to be released on the application cycles opening up. The loan repayment program, you must have an approved site to qualify for and apply for that program. New service site application, those are, that's the period where new facilities can apply, or if you've let your application lapse, you can reapply during that time. And then your site will be approved by the end of that year, that calendar year. For those sites that are currently service sites under the National Health Service Corps, you are required to recertify every 3 years. That usually occurs in the summer. The scholarship program, and that's available to medical, dental, and behavioral health. That opens up in March. A new program that's about 5 years old is called the Students to Service Program. They call it the S2S, so you've probably heard of that. That will open up for application in 18 or the fall of 2018. And then the Health Workforce Connector is now the job board for the National Health Service Corps. And once you're a service site under any of their programs, you can advertise your site or job openings under that connector. Okay, so approved sites. To become an approved site, you must be located in a HPSA, whether it's primary care, dental, or behavioral health. And you do not have to provide all of these services, but you can be a primary care site, you can be a dental site, or you can be a behavioral health site. And if you provide all 3 of those services, you have 3 different HPSA designations. Provider services, you provide services regardless of the patient's ability to pay, and you do that through a discounted fee structure to patients who qualify. You'll hear us refer to that as a sliding fee scale, but it's also referred to as a discounted policy. And then you must accept patients covered by Medicare, Medicaid, and CHIP. Now, the National Health Service Corps has a 2-tiered loan repayment, and I would encourage you to go to their website. All you have to do is Google it, and it'll come right up to their page. They offer $50,000 to primary care providers practicing in an approved site with a HPSA score of 14 or above in return for a 2-year full-time commitment. But they also offer a half-time, part-time commitment, and that would be half of the award. And so that $50,000 is $25,000 for each year, and that's 2 years. The second tier is a score of 13 or below. But I must say that I have yet to see a year where they have funding to get to that second tier. Normally the funding is spent, and it's spent on a first come, first serve. Applications are accepted again around February or April. And if you need to update a facility score, you must do that before the December 31st, because on January 1st, HPSAs are frozen for a 3-month period so that this program can accept applications for loan repayment without HPSA scores moving around. So if you have a low score and you think that you could increase your score, I would encourage you to do that. The Student to Service program provides up to $120,000 to medical or DOs or dental students still in training in their final year of school in return for a commitment to provide primary health care full-time for at least 3 years at an approved site in a health professional shortage area. The same way a loan repayment person would be expected to repay, except this is a 3-year commitment. The other two programs that have now moved under the National Health Service Corps, but there's still a separately funded program, is the Nurse Corps. And there's two offerings under the Nurse Corps. One is scholarships, that's one pot of money, and the other one is the loan repayment. And loan repayment applications are accepted around March. Scholarship applications are being accepted now through June 17th, 2018. This is an excellent way through the scholarship program for rural areas to build workforce. If you have an LPN that would like to return for a BSN, or if you have a BSN that would like to become a nurse practitioner, they can apply for scholarship funds through this program. So I would focus on identifying a couple of key people that you might want to tell about this program. Okay, now the loan repayment for the Nurse Corps works a little differently, or much differently, than the loan repayment for National Health Service Corps. This is based on the amount of debt, and participants receive 60% of their total outstanding educational loan balance incurred while pursuing an educational education in nursing in exchange, for a 2-year service commitment. They can reapply after that 2 years to receive an additional 25% of the original loan balance for a third service year. And these are the individuals that can apply: nurses, advanced practice nurses, and they refer to their facilities as critical shortage facilities or nurse faculty. So when applying for this program, a nurse must, they use a debt to salary ratio. And that debt to salary ratio is 100%. So if they make $50,000, the debt must be $50,000. If it's lower than that, more than likely they can apply, but more than likely they will not be funded. There is because the debt load is what they rank those that they will approve and fund versus HPSA scores on this one. Okay, so what is a critical shortage facility? And this is a public or private nonprofit healthcare facility located and designated as or serving in a HPSA, an area with shortages of primary care or mental health. You don't see dental in this one. To receive loan repayment as a registered or advanced nurse, you must work full-time in a critical shortage facility. If you have questions about whether you qualify or you don't see your name, your facility name on the list at Healthcare Connector, Workforce Connector, contact Eugene Thomas at this address. And if you feel you qualify and you meet the requirements, Eugene is the one that can request that your facility be added. Okay, these are the qualifying facility types. We understand our critical access hospitals, our DISH hospitals, public and private. FQHCs, Certified Community Behavioral Health Clinics, ambulatory clinics, home health agencies, hospice programs, Indian Corps, rural health clinics, public health departments, and nurse-managed health clinics, urgent care, surgical centers, and then the renal disease and residential nursing homes. So you see opportunity for registered nurse and advanced nurse practitioners to receive loan repayment through this program, and it's the only one that I'm aware of. Now, our state loan repayment program, the purpose of that program is to increase the availability of primary health care services in HIPSs by assisting in repayment of educational loans. So physicians and dentists can receive up to $30,000 annually for a 3-year commitment. Other professionals can qualify up to $15,000 annually for a 3-year commitment. To be a qualified work site, you must be a work site in a federally designated HIPSA. It must be public or nonprofit, which is different from the National Health Service Corps. And it must be full-time, is a 40-hour week in outpatient capacity. You must accept assignment of Medicare and Medicaid, and must work in a clinic with a posted sliding fee scale or low-income uninsured patient policy. The application period is April 30th through June 30th. These are the qualifying disciplines for the state loan repayment program. Your MDs, your dentists, your nurse practitioners. This also includes nurse wives, PAs, and nurse practitioners, your registered dental hygienists, your health service psychologist, and that's called an HSP, and they must be clinical. And then your LPCs, your licensed clinical social workers, your psych nurse practitioners, and I see we have LPCs listed twice. Okay. Under the J-1 visa waiver program, there are 3 ways to access being able to hire a J-1 visa doctor. The state has authority to sponsor up to 30 primary care physicians and specialists under the Conrad State 30 program. There's another avenue available to providers or employers in the state, and that's because our state, and most of the parishes, there are a few parishes that aren't part of the Delta Regional Authority, but their program is Delta Doctors. And if you are interested in hiring a J-1 visa physician, you can apply to either one of these avenues. The third avenue is through HRSA. Now, they only accept J-1 visa waiver applications for FQHCs and rural health clinics. But that's an avenue that you can eliminate a lot of the requirement on the Delta or the state part and go directly to HRSA. So the Conrad State 30 program, these physicians are primary care or specialists and who are training in the U.S. on a J-1 visa. And they're applying to work 3 years in the U.S. instead of returning to their home country for 2 years before working in the U.S. So they must apply under one of the 3 programs that I mentioned on the previous slide. A specialty physician must establish a dire need. Now that dire need is explained through, it could be shortage of appointments, it could be a shortage of that specialty, it could be shortage of specialties accepting Medicaid, it could be a chronic disease within that region also. So employment sites must be in a designated HPSA, or they serve residents who reside in a HPSA, and they also accept Medicaid, Medicare, and the uninsured. There are 10 flex spots available for this type of designation. So those are the employers that fall outside of a HPSA, but they still offer services and serve patients that reside in a HPSA. So in those cases, we ask for patient-level data as to the origin, the insurance origin of those patients, and that must be demonstrated. And the physician must work full-time. There is not a part-time offering. The Delta Regional Authority, this is the link to the Delta doctors. We also offer the National Interest Waiver, and these are foreign physicians or J1 physicians that have worked in HPSAs for a total of 5 years. It doesn't have to be in Louisiana. It doesn't have to be under our program. It can be whatever program they qualified for and provided services for 5 years. If they must, for a Louisiana document or support letter, they must be currently either employed, or they can provide us documentation that they were employed during a certain period of time. So this being 2018, if they were employed in 2016 and can provide us the documentation that they provided service, we would document for that 2016. And they can serve more than one health professional shortage area. Okay, the Oral Health Workforce Development Grant is another way that we are expanding workforce into our HPSAs and rural and underserved areas. With this grant, LSU School of Dentistry formed the Rural Dental Scholars Training Track, and there have been 2 students that have been identified and awarded this grant. Well, it's a grant, it's a scholarship offering through the School of Dentistry. And in return for that scholarship, they agree to work in a rural HPSA dental area for a total of 1 year for each year that they receive the grant. So if they receive the grant for 2 years, they serve 2 years in a rural and underserved area. We're also working on and conducting at this time a statewide dental needs assessment, and many of you will hear about that through your facility, and that's to identify the issues around access to dental care. There's also the Oral Health Recruitment Service, and there's 2 oral health recruitment recruiters, and their names are on the last page of this presentation. That's Trudy and Nicole, and they're working in rural areas where there's a a health professional shortage area, and if you need assistance, they're there to help you. One of the areas where this is free to our Louisiana employers. Several years ago, critical access hospitals, small rural hospitals, FQHCs, and rural health clinics said, we need assistance in competing with the big organized systems that have recruiters. And they said we can't afford to pay recruitment fees for these small practices. So there was a group of recruiters for states that came together with a HRSA grant to form the National Recruitment and Retention Network. So this is a network, a nonprofit organization, and a network of 50 states that participate and offer a way for smaller employees to reach candidates nationwide. And this, through our participation in this network, we pay a subscription fee so that any of our providers within Louisiana can offer and they can advertise their job postings at this site. So it's a source of job postings. As you see, we have 67 active job opportunities posted there. But more importantly to you as facilities, this is a source of active candidates also. If you have a job listed on the site, you automatically receive a list of those candidates that have logged on to the 3RNet that month to look at job opportunities. They may have registered that month, but they are active candidates. And within that pool, within that 3RNet, there's also 348 of those candidates in that site that have active Louisiana licenses. They have the ability to go to work tomorrow. If you want to become a site under or an employer that can offer jobs under 3RNet, that's the link, and you can apply. And that application then comes to the primary care office and is approved. Or if it's not approved as offered, we will discuss that with you at that point and how it can happen. Our goal, though, is to keep out professional recruiters that charge fees. And this is exclusively for those advertisers within 3RNet. Okay, something that some of you have written about or called me about or emailed me is there's a change in the small town health professional tax credit. In 2018, health professionals working in rural and primary care and or dental HIPSAs can apply for a tax credit. This is a recruitment tool, and because this can sometimes make a difference between a provider choosing a urban location or a rural location. So I would use this tool in your description of your opportunity. So this will be available to primary care physicians, dentists, and nurse practitioners that are located in rural areas, and also they are in a designated dental or primary care HIPSA. Doesn't matter the HIPSA score. They only need to be located and work within that health professional shortage area. So these are your contacts within the Bureau of Primary Care and Rural Health. And there's Kimberly Jones. She is the unit manager. Beth Butler, many of you know. She's not only the HPSA specialist, but she's also the state loan repayment manager. There's Trudy Bell Wickham, and she is your oral health recruiter for more of the southern part of the state. Nicole Corsi, you heard her earlier. She kind of wears many hats, but she's also our oral health recruiter for the central and the north part of the state. So you can talk to her. My phone number, this is Dory. I didn't include it, but you're welcome to call me. It's 225-921-2220, and that's my cell phone. This is our website. The information that you've received today is on our website, and the links to those programs are also there too. So you can go there for the National Health Service Corps, the Delta Doctors, the Conrad 30, and also to the links to these individuals. So at this time, I welcome questions.
Thank you, Dory. I appreciate the presentation. It was full of information. Great stuff. I'm going to give everybody a second. If they would like to ask a question, you can use your chat feature, or you can raise your hand and I will unmute the microphone. I have received a couple of emails and a message in the chat feature about getting a copy of the slides. We will be emailing out a copy of the slides and also a link to the recording of this presentation. We are recording this. So if you missed something and want to go back and re-listen to it, you will be able to do so. If you want to share the recording with someone else in your office, you will be able to do so. All right, any questions? If you think of anything, Dory has provided everybody's email addresses and phone numbers. Please feel free to reach out to any one of us, and if we can't help you, we will steer you in the right direction. Again, thank you, Dory, so much for coming in and delivering this valuable information, and we will be following up with everybody in an email with some attachments. At the end of this presentation, you should be presented with a link to do an evaluation. Please take 30 seconds to complete the evaluation, so that will help us in future deliveries of Ask Rural Health. If you have any topics or ideas for topics for future deliveries of this webinar series, please contact myself. I am Nicole Corsi, nicole.corsi, C-O-A-R-S-E-Y, @la.gov.
Thank you. This is Dory. Call me if you have any questions.